Alrighty guys, before I start out the video, I want it to be known that if you have any disagreeing thoughts, or maybe you have some statements that you would like to say in response, I'm happy to hear them in the comments section below. So yeah, this is the quarantine regime comparing public and for-profit healthcare during the COVID-19 pandemic. Wealth inequality has been an important issue faced by the American people since the foundation of the United States. We could see this with examples such as people having to have property before being able to vote early in early America. And we see examples of these wealth inequalities throughout the history of the United States. But it is still a common debate of whether wealth inequality is still as impactful in modern society. During the COVID-19 epidemic, U.S. citizens experienced wage inequality firsthand as many workers were denied accessibility to COVID-19 test kits and facial masks used to prevent the spread of the disease. At the same time, celebrities such as athletes and other wealthy Americans were able to budge to the front of the line, obtaining access to test kits and face masks easily. A specific example I remember was Rudy Gobert is an NBA basketball player. He gets coronavirus and it has instant test kits, while nurses and stuff are unable to obtain these when they are directly being exposed to the virus. The disproportion of medical supplies to impoverished communities was only allowed due to America's for-profit medical system, as hospitals saw an opportunity to make some extra cash by only providing test kits to wealthy patients. And I understand that there was a lack of test kits at the first, but to use wealthier people before workers draws some concerns. The act of wealth determining medical supply accessibility seems to misalign with the United States Constitution and the fundamental belief that we are all created equal in this country. In order to battle wealth inequalities, America should look to switch their for-profit hospitals to publicly funded ones. Fueled by America's free trade and capitalistic views, it is not irrational that America's hospital systems were founded with profits in mind. Early hospital owners saw marketability in healthcare and began treating hospitals as businesses. Between the 1970s and 1980s, the 5 largest for-profit chains returned nearly triple that of other sectors of finance. That was published by, that information is coming from Patrick Paulus Theodore Jurison in the For-Profit Hospitals article that he wrote. I just wanted to give credit to, I'm going to be giving credit to places I source so that you guys can also look them up if you would like to take a look at them. But anyway, these chains saw exponential growth through the 70s and 80s that by 1982, they grew 43% through the purchase of others' for-profit hospitals, which proved the medical field to be immensely profitable. And again, I'm getting these statistics from, this one comes from Bradford Gray in his For-Profit Enterprise in Healthcare article posted from 1986. However, as these hospital chains continue to grow, so did the price of healthcare and their profits. This is leading to rising inequality in access to healthcare, as many Americans are unable to afford insurance or pay the high volume necessitated for private medical care. Instead, a non-profit public healthcare system would be an improvement and help deal with wealth inequality by providing a healthcare system for all. With a public healthcare system, medical supplies would be given out on a first-come, first-served basis rather than to the highest bidder. This would eliminate healthcare inequalities such as the denial of COVID-19 test kits seen earlier this year. While a public healthcare system would help eliminate some of America's wealth inequality, there are still many who oppose healthcare as a right and renounce the production of a national healthcare system. A central belief of a supporter of a for-profit healthcare system, and believe me when I say this because I used to be one of those people, is the belief that competition between private healthcare corporations fuels lower prices on healthcare. I remember watching Ben Shapiro videos back in high school, and that that a common source for this notion would be that LASIK eye surgery. Basically, in 2018, the American Refractive Surgery Council put out an article showing that LASIK surgery had been reduced by 15% from 2008. The price was able to be lowered because separate investor committees own these private organizations that provide LASIK, and that it was in their best interest to lower the cost of receiving surgery in order to obtain more patients. And theoretically, this competition is never ending, so as time goes by, so does the cost of hospital bills. They continue to go lower. Despite their confidence in for-profit hospitals, besides LASIK, studies find that the belief that for-profit hospitals provide cheaper alternatives to healthcare to be fictitious. An article published by Gerard Anderson found that in 2000, considerably more on healthcare than any other country in the world, whether the results were measured by per capita or by the percentage of GDP. And what we're really looking at is this per capita. It's the most important one because at the same time, hospitals' usage, such as physician visits per capita and hospital days per capita, were also below average when compared to a majority of developed countries. Like a majority of just countries in general, America was spending more money than all of them, but receiving seemingly less care than all of them as well. These numbers suggest that Americans are paying more for less healthcare, which falsifies the belief that competition from for-profit hospitals leads to lower prices in healthcare. In actuality, for-profit healthcare generates more inequality towards access to medical supplies. A research article published by Samuel Dickman et al. Found that 39% of Americans with below average income reported not seeing a doctor for a medical problem as a result of the cost. That's 39% of people in below average income reporting not seeing a doctor because they have some medical issue. In comparison, the same research found that only 7% of low-income Canadians and 1% of low-income citizens in the UK did not see a doctor. That means we are almost 39 times more likely to not go see medical supplies because of the cost. And when you compare Canada and the United Kingdom to the United States, it's obvious that these countries share a more liberal view on healthcare systems for their countries. This disparity in percentage is being caused by higher rates of uninsured or low-quality insurance among Americans with lower income. This statistic shows that citizens in more liberal healthcare systems are better able to achieve medical care and presents evidence towards wealth inequalities, and the wealthier Americans can access healthcare more frequently, generating inequalities towards impoverished citizens. A public healthcare system would allow anyone to see a doctor, eliminating these inequalities. In the face of this, people still argue that competition of for-profit healthcare promotes innovation in medical technologies. Many believe that since private healthcare companies are continuously profiting from their hospitals, more financial resources are available for the development of new technologies in the medical field. These developments lead to new medicines and techniques, resulting in better healthcare. Information gathered by the Wharton School of the University of Pennsylvania from the CDC shows evidence of these developments as life expectancies have gone by almost 40 years since the 1900s. So basically what we're seeing is in this system, since the 1900s, we've basically been able to shoot up 40 years of life expectancy based off of technological advancements in the medical field. However, research suggests that for private healthcare is not necessarily leading to the best innovation in healthcare. In a review of 12 studies done on for-profit versus non-profit healthcare, Cristian A. Herrera et al. Found that mortality rates and cost of services were both higher in for-profit hospitals. This data supports better quality care in non-profit hospitals, showing that it is probable that a majority of earnings of for-profit hospitals are actually just going into the pockets of investors rather than towards the development of new medical technology. It should be also noted that Herrera et al. Also suggests a correlation between nonprofit hospitals being more efficient in healthcare, but as we all know, correlation does not mean causation, and it is suggested that more data be collected to be assured of this point. But the fact that there is a strong correlation that they are more efficient just adds to the fact that they also lead to lesser mortality rates and cheaper costs. Anyway, undeterred by this evidence, the biggest argument towards public health care is the cost. Many Americans are against the extra taxation required to fund a public health care system, which is totally okay with that belief. And while not wanting extra taxes seems reasonable, these beliefs become irrational when looking at the United States spending, especially during the COVID-19 quarantine. Since the pandemic, the U.S. Senate passed a $2 trillion bailout plan to help the economy, much of it going towards large corporations. Coupled with the fact that the United States has spent $6.4 trillion on war post 9/11, it is seemingly ridiculous to argue over the cost of public health care, as we've spent almost $8.4 trillion on bailouts and war. What did we even really accomplish? What did we really get a foothold in? This substantial amount of spending was paid for through taxation, which suggests that if we change how our government is budgeting, it is quite possible that we could provide health care to all. While critics of a public health care system say that it would harm the economy, there are several economic benefits for national health care. If all citizens are having their illnesses treated, it is reasonable to assume that the nation's workforce will be more productive, which could result in an increase in worker output as well as lower rates of disability compensation. Additionally, with the government lobbying fair prices with the hospital facilities, we would be able to achieve better health care for less than current citizens are paying. A national health care plan would also be beneficial towards U.S. businesses, as employers could use money previously allocated towards employee insurance plans towards further developments of their companies. This would promote company growth, making U.S. businesses more competitive internationally and open more job positions to the public, helping unemployment figures. Regarding the general public, a national health care system would eliminate much of the stress in today's for-profit structure. In a public health care system, there would be no need to go through an insurance company, granting citizens more healthcare freedoms, such as picking the specific doctor that they would like to have rather than deciding one covered by your private insurance. Moreover, unexpected deductibles and premiums would not exist, making budgeting easier. The national healthcare system would also help impoverished individuals suffering from unaffordable illnesses, directly helping lower wealth inequality in the United States. Inequality of wealth in healthcare is rampant currently in the United States, as wealthier individuals are currently given access to medical supplies and techniques over everyday citizens, even those fighting towards COVID-19. And if you're watching this video and COVID-19 is just a thing that we talk about in the past, it's still important to realize that this happened in history. Whether it be COVID-19 test kits, MRI availability, professional athletes can get those instantly, or the transplant of even organs, it has been proven through numerous studies that countries with non-profit hospitals are more effective and less costly than when compared to for-profit facilities. Passing a program that sets up a national healthcare plan would be the first step in the right direction to ensure citizens' health equality and would even support lowering wealth inequality. I believe that is the government's responsibility to soon ensure equality amongst all citizens regardless of wealth, or it furnishes the belief that our country has made little progress in developing true equality. I hope you guys enjoyed this different kind of video, but it's an issue that I wanted to talk about, and I would love to hear your guys' ideas down in the comments below. So I guess that's going to be all. So don't forget to like or dislike. I don't care. comment and subscribe. Comment and subscribe.